here at Roswell Park?
Hi, I'm Kazu Takabe. I'm the Chief of Breast Surgery here at Roswell Park Cancer Institute.
I'm Jessica Young. I'm also one of the breast surgeons here at Roswell Park.
And how long have you both been here?
I just started 8 months ago.
And what brought you here? The weather?
Well, Roswell Park is the oldest National Cancer Institute designated cancer center, and I have always been known about its resource, and that's attracted me here.
Great.
I've been here for 5 years. I actually did my fellowship training here and stayed on, and as Dr. Takabe says, the snow is awesome, but also Roswell is really a one-of-a-kind place to work.
Why are you guys passionate about your jobs? What gets you up in the morning?
So obviously we're both surgeons, and so I have to say obviously we love doing surgery and being able to concentrate on a specific area of cancer that we know that we can cure with surgery is really an awesome feeling. And I know Dr. Takabe will be able to tell you more, but there's just so much research in this area and so many different ways that we can help women through this, and it's a really great field to be in.
Yes, we do both the clinical activity, which we are surgeons, so we operate on breast cancer patients, but also we do a lot of research. And both of those activities does help our lives. And what more is gratifying than helping lives?
I agree. So we're here today to talk about something that's been in the news recently. Younger women with breast cancer are increasingly choosing to have double mastectomies. Can you discuss this and what you've seen, what you think about it?
Well, in clinical practice, it is true that for the last, let's say, 2-3 years, we've been
at least.
Yes, we've been recently seeing in a sense, a surge of patients more and more asking for double mastectomies.
And it's definitely the younger patients, too, I think, who pursue it a little bit more than our older patients tend to. Some of them do, but more usually the younger patients.
Well, let me clarify what double mastectomy is. So usually the breast cancer comes up in one breast. But when the patient receives that news, some patient decide to have the both breasts removed, and that is called double mastectomies, and that is recently having some feature in the media. Now, if you look back on the history of how the breast cancer was treated, 120 years ago, the treatment for breast cancer was surgical removal. As a matter of fact, one of the surgeons, whose name is Dr. Halstead, oftentimes referred as the greatest American surgeon ever, who was the founding chair of Johns Hopkins, established an operation called radical mastectomy, which is when you have a breast cancer, you not only remove the whole breast, but you remove the muscle underneath as well. So the philosophy at the time, the underlying rationale, was to try to remove as much as tissue as possible surrounding the cancer, therefore try to stop the cancer from spreading. So that was the rationale 120 years ago. Well, there's a lot of technical advances then, especially now even us surgeons has realized that surgery is not only the weapon to fight this deadly disease. And what we have noticed is that the cancers are scary because it spreads. And of course, when the cancer is small, well, it's going to invade in the surrounding area. Now, what we have realized after the decades and decades of research was that we can actually just remove the cancer with the appropriate margin, and we can zap the remaining breast with radiation, and that actually efficiently suppress the risk lower the risk of the cancer coming back in that breast. Even more better, if you use some drugs, it does lower the risk as equivalent to removing the whole breast and underlying muscle. Therefore, the surgical removal has become smaller and smaller and smaller with the adjuvant treatment. Now what's happening these days is that even with those scientifically solid evidence, some of the patients are actually choosing to remove not only the breast that's been affected with cancer, but even the other side, and that's making the headlines.
Yeah, I mean, definitely, I think the trend before, for a while, was to go to lumpectomy, and almost everyone chose that. And now we're starting to see, I think, a little bit of a rebound the other way. And, you know, we often see patients who ask whether they should do a double mastectomy or not. So they have a choice between a lumpectomy, a single mastectomy, or a double mastectomy. And a lot of them are really maybe misinformed about the reasons for why they're, you know, choosing certain things. And so a lot of the time that we spend in our visits is really to give them more education so they can make a proper decision. So really, I think there's really two major reasons why patients tend to choose or decide that they want to do a double mastectomy. One is really that they're afraid of cancer spreading to the opposite breast, and actually that's a huge belief out there, but really cancer does not spread from one breast to another. It is just, it really, if you get breast cancer in both breasts, first off, that's fairly unusual, but second off, it's not one breast cancer going to that side. They would be completely separate cancers, and they may be treated completely separately and in different ways. So that's the first thing is I think patients don't really realize that cancer can't go from one side to the other, and they also don't realize how fairly rare it is to get breast cancer in the opposite breast. So there are exceptions to that. So in general, most patients, the chance of getting breast cancer in the opposite breast is going to be under 10%, probably around 6 to about 8%, depending on how old they are when they develop their breast cancer. So if you are a little bit younger, you probably have a slightly higher chance of developing breast cancer in your opposite breast just because you have a longer time to live, but it's not going to be much higher, just a couple percent higher. The exception to that would be if you have a gene mutation, in which case the chance of what we call contralateral or opposite side of breast cancer is going to be much higher, more along the lines of 30 to 40%. So I think patients don't really know that a lot of the times, and when they hear the real numbers, you know, it's more reassuring than they would have thought to begin with.
So this double mastectomy isn't something you typically recommend. It really is women coming to you saying, I want this, for the reasons you outlined.
Yes, that is correct. So one thing that we should be crystal clear in terms of the science is that, just like Jessica described, the breast cancer, well, first of all, yes, cancer is scary because it does spread. No question about that. But how does breast cancer spread? It spreads to its lesional lymph node, which is at the armpit. Breast cancer spread to the lymph node at the armpit. Then, if they spread even more, that usually goes to the bone. It can go to your lung. It may go to your brain, or sometimes to the liver. So those are the how they spread. And if you have noticed, the other side breast was not on the list. So it'll be very rare that it's going to spread that way. So yeah, that message needs to be clear. But Jessica was right that one of the reasons that many of the, especially the younger women, asking for double mastectomy is the publicity made by Ms. Angelina Jolie, which is, first of all, very famous actress that everybody knows. And the second, she did have a mutation on her breast that indicates that she has a bad gene that basically have a high risk of developing breast cancer on the other side.
Right. So I think people fear or see what she did, and what she did was very reasonable and very thoughtful. And it was wonderful of her to even come forward with all of this because it's not an easy topic to talk about, and she's revealing a lot of personal information about herself. But actually, she's in really a minority of patients across the board. So the type of gene mutation that she has really only affects 5% of women who even have breast cancer. So when we have people talking about bilateral mastectomies in our clinics, most of them don't have this reason to apply for why they should have a double mastectomy. And I think another important point that going along with the fact that breast cancer doesn't spread to the opposite breast, which we often tell patients, is that it does not, in any study, has never increased the survival of a patient's life to take off the other breast. So while the chances that you might get breast cancer on the opposite breast do exist, usually once you've had breast cancer, you are probably getting your screenings regularly, and if we're going to find anything, it tends to be hopefully fairly early. You will also have received treatments that may decrease the chance that you'll get breast cancer on the opposite breast. And so really it doesn't affect your overall survival, which is, if you're going to do something as dramatic as that, you want it to have a real effect on it. And, patients, they don't really understand that when they first come in. So it's definitely something we go through and educate them about.
And Dr. Young, part of your role here is managing our high-risk breast clinic where you can test for those gene mutations.
Right, absolutely. So that's a whole other topic for another day. There's many, many reasons why people might be at risk. And so particularly if you have strong family history, either on your mother or father's side, of breast cancer or ovarian cancer, it's very reasonable maybe to be tested for this gene mutation. And when we meet patients for the first time who have cancers, we often evaluate their family histories to see if they need to have gene testing, to see if it would be reasonable to have the other breast taken off. So certainly that's a part of our entire process, but risk factors are a totally different discussion for another chat, another day.
So Dr. Takabi, you made it very clear that the science is evident that, double mastectomies don't necessarily have benefits. Are there risks when they're not recommended? Are there risks to removing a healthy breast?
Yes, that's another thing that the patients needs to be aware of. So although with the advancement of the technology and the science, operations are done very safely these days. However, operations are not like changing your tire. It's not that it can be put on and put it off. Yes, indeed, your body will be cut and it will be stitched. With our latest techniques, we can make it less visible, or in certain actresses' time, maybe even appealing. However, they do undergo cutting and stitching. So your body does develop scar. That's number one. Number two, yes, indeed, there are risks. Any surgery, it can bleed. It can get infected. Those are given risks, just like even you're driving a car, you always risk a traffic accident. Same wise as surgery. Yes, indeed, it is safe. However, there is risks, and that is not as walk in the park.
Well, I think too, along with just the risks, I think patients. So the other major reason why patients tend to want to do the other side is because they don't want to be lopsided, or they want both of their breasts to be equally to be equal or symmetric is really what we say. And that's a really reasonable reason to take off the other breast. But along with the complications that can come with surgery itself, I think it's important to emphasize that really when you're taking the breasts off and reconstructing them, or you may choose not to have reconstruction, but if you choose to do reconstruction, they can make it look very good, but it's not going to feel or function like a native or natural breast. So what that means is if you're young and you still want to have children, you're not going to be able to breastfeed. Even if you keep the nipple, which there are cases to do that and cases not to do that, you're not going to have sensation in that area. And a lot of patients say after the procedure that they really feel very different about their body, their own self-image, and it really changes the way that they relate to their spouses or their significant others. It may even relate to how they may not want their children to see them naked ever because they, feel very differently about their body. And it's really underestimated, kind of like the psychological impact of that. And granted, if you take one breast off, it's certainly going to feel that way sometimes, but you do have the other breast that can, still be more natural feeling and make you feel more natural in a lot of ways. And I think people underestimate that when they look at the entire picture because they haven't been through it yet and they don't know what it's going to feel like. But that's definitely a consideration too that I try to point out to patients as well. Aside from all the obvious complications of surgery too, that we don't like to do surgery that's unnecessary if we don't have to, because surgery is surgery. It's not a small thing to undertake, no matter what.
We have a question from Melissa, as well as many people, Dr. Young, commenting, thank you for saving their life to you.
Oh.
You have a lot of Facebook
Very
fans
sweet.
out there.
Mm.
So Melissa says, thank you, Dr. Young, for being an amazing doctor to me. I'm wondering if you could quickly discuss how previous radiation treatments that are across the chest wall may be another reason to have a double mastectomy. I'm not sure many people are aware of this.
I guess that question could be a couple of different questions.
So radiation treatments, how does that impact the treatment and removal?
I think, so another reason why some people might choose lumpectomy versus a mastectomy, so if you're given a choice, most women who have breast cancer are candidates for lumpectomies, meaning that we don't have to remove the whole breast because their cancer is small enough in proportion to the size of their breasts that their breasts look relatively normal with that. But some people don't want to do radiation or they're worried about the side effects of radiation. So radiation is definitely, it's a well-tolerated form of treatment for breast cancer, and it is one that we always recommend with a lumpectomy almost all the time. Mm-hmm. But radiation will make your skin a little bit thicker. It will make it tighten up a little bit and a little bit darker in color. But it also makes you not heal as well in the future. So if you were in the future to then decide to have a mastectomy for whatever reason, it would be a little bit, we would worry about your skin healing a little bit more than we would with your just natural skin. And so there are some people who worry about that. Other people are worried about side effects of radiation to, like extra radiation getting to the underlying ribs or to the heart or lungs underneath. Or there are even possibly secondary cancers. They're very, very rare, but there are cancers that you can get from radiation itself. So those are reasons people may want to avoid radiation and thereby choose a mastectomy.
And also, depending upon where you live, you may have a difficulty actually getting those radiations. The radiation therapy usually is daily throughout the week for 5-6 weeks.
Yeah, it can be as low as 2, but sometimes as high as 6 weeks. So it's not easy.
So if you live far away from those institutions, yes, that is quite a bit of burden, and that may come into the decision making to some patients.
Yeah, absolutely.
So it really sounds like everything you're saying here today is that education is key, and that knowing the science, knowing what your exact diagnosis is.
I mean, I think education is a huge part of what we do when we meet patients for the first time and kind of go through all the different options for them. And I'll always say that breast cancer is wonderful. There's so many new options and things coming out, but it's also a hard field to navigate for patients because they have to make some decisions themselves. They'll always say, what would I do? Maybe not what you would do if you had breast cancer, but that's a hard thing to answer because everyone, it's your personal body. It's a big decision. But absolutely, I mean, I tell patients that if they choose to have the opposite breast off, that's fine. That's a very valid thing, but I want them to understand that there are complications to it. I want them to understand that it may not help them as much as they think it will. And I want them to understand, what the reconstruction process will look like in the future or what they'll look like without reconstruction so that they are, just so they understand everything on the table and they don't have, false hopes or anything like that.
I pretty much echo that. And the take-home message is scientifically, it is discouraged. Scientifically, there is no reason that you need the other side of your breast taken off. Scientifically, there is no reason. And yes, indeed, they do involve risks. That is a take-home message. However, us breast surgeon here at Roswell is here to help the patient. And that is not only about the cancer control scientifically. if the patient has such anxiety, if they're so worried about the very slim possibility that they may have something wrong with the other breast, and if they need to live with that anxiety for the coming years, yes, we're here to help the patient, including their feelings. So we do kind of, if that's what they insist, and if they clearly understand the rationale and they clearly understand the science, and even though they understand that they're not really decreasing any scientific risk, however, for their psychological well-being, if they request and if they want that to happen, yes, we're here to help those patients.
Well, and exactly, I mean, it's okay to want to look the way that you want to look, and I think that's a huge message too. And I think women are really proactive about fighting for that, and I think that that's really reasonable as well. So it's not an easy decision in either case. And one other thing that we often present to patients as well is that you can do something to the other breast to help make it more symmetrical with the affected breast. That doesn't necessarily involve taking off your whole breast. So we really have a lot of different options out there for you, but absolutely it's, however, we want the point of cancer or the point of fighting cancer so that they live longer, but you want them to live better as well, and you want them to feel good about themselves when they're done. We're not meant to try to scar people forever, in the hopes of getting rid of cancer. It's to help them through their disease and make them feel good so that they can lead good lives when you're done, really.
Thank you. This has been excellent. Before we go, we can't talk about breast cancer without talking about mammography. So we have our new breast imaging center here at Roswell Park. Who should be coming in? How often?
Well, that's
so
a super
women
broad
over
question
40 every year, and we offer them right here now, right?
Right, yeah.
So that is very, very important. So in the end of the day, cancer is the disease that it gets big. So obviously, it is better to catch it early. And until recently, unfortunately, Roswell did not have the screening program for general public, but no longer. Yes, we did start the screening program, so we can do the screening, meaning that every woman over 40 can have the breast cancer screening and have the mammography taken in the Roswell Park, where the nationally known mammographers can read those mammographies, and that will help unfortunately, if you develop something in an earlier stage.
Plus, our facility is beautiful. It really is. It's gorgeous. It's a beautiful place to come. I mean, it's to do something that you have to do. It's a beautiful place to come, and the staff is awesome. And I've heard that the techs are really gentle. So I think that's a huge thing when women are thinking about mammograms too.
Great. Thank you both so much for joining us today.
Oh, you're welcome.
Welcome.